Welcome to the Local Outbreak Advisory Board. For the benefit of the public, I'm Howard Wollaston, Executive Policyholder for the Public Health and Community Wellbeing, Leisure and Culture, and Chair of this board. I'll be assisted today by James Townsend as Clerk for the meeting and by Kevin Griffin, who is the Zoom host. I'll now ask James Townsend to display some reminders about how we conduct meetings via Zoom.
In addition to these points, if it becomes necessary for members to telephone into the meeting, you will not be able to signal to speak. So once everyone who has raised a Zoom hand has spoken, the chairman will ask anyone who has telephoned in to speak in order. Any voting necessary will be done by show of physical hands. If we need to adjourn the meeting for any reason, then the chairman will advise the board of the revised time and date of the meeting. If it is a short adjournment, you'll be able to rejoin the Zoom meeting. Otherwise, a fresh appointment will be sent. Do members have any questions about the way in which this meeting will be conducted?
Thank you, James. The minutes from the last meeting, I've been through them and can't see any problems, but could anybody indicate whether they are fair and true record? In which case I will sign them electronically. Any declarations of interest? None. I'm sorry, I've skipped apologies. Do we have any?
I would just have apologies from Mandip Bilku and Councillor Vickers, who is being subbed by Councillor Macro tonight.
Thank you. Welcome, Councillor Macro. Therefore, move on. As these meetings for the last 2 or 3 sessions, we've had a visiting speaker, or in this case 2, and I'm going to kick off with Davina Nicholson, who's the clinical lead at Time to Talk West Berkshire. Davina.
Hello. Can I screen share my presentation, or can you do it for me, James?
You should be able to.
Okay, let's try screen share. Okay. Has everyone got that?
Yeah, perfect.
Thank you.
Okay, fantastic. So just to try and go through, I think you only want me to talk for 10 minutes, so I shall try not to get too long-winded. Yes, I am the clinical lead at Time to Talk West Berkshire. Time to Talk West Berkshire is a youth counselling service, been around for a while, since 1985. The main thing that we do is one-to-one counselling for children and young people between the ages of 11 and 25. We are BACP accredited, which means we're quality controlled. And recently we have been doing more and more presentations, workshops, and we used to go into schools to do assemblies as preventative work, but now we're doing them online. So I want to start by the sort of big picture, which I'm sure everybody is probably aware of. That there has definitely been an impact on children and young people's mental health throughout the various lockdowns and since the pandemic became a reality for us all. And it is felt very strongly that we need to make sure that as part of our sort of build back and our recovery program, we do think about the long-term effects of children and young people's mental health. This is now coming right down to the very personal. One of our young ambassadors who has been through our counselling service said this to us, and we've had many more similar expressions from young people. I hope I'm not going too fast. So our picture was that during the first lockdown, it was almost as though the world stood still and our referrals dropped right down to an average of 13 referrals a month. Our normal average is around 30, 32 referrals per month. Then, as we came out of the first lockdown and headed towards the second one, sort of August, September, October, November and December, referrals were right up at 40, 41 a month. bearing in mind normal is around 30, 31. So we're up again a third on what is normal for those months. January hadn't finished by the time I did these stats, and I haven't had a chance to catch up with my colleagues, but January will come out as quite a normal month. Interesting, we've gone back into another more serious lockdown, and we're getting slightly fewer referrals than we were in November and December. We think that might be because fewer young people are in school, and school has two effects. One, it causes stress and difficulty, but two, it is a place where young people get to talk away from their families about what their problems are. So for both if you like, a good reason and a perhaps not so good reason, the fact that fewer young people are in school, we think is having an effect on our referrals in January. And I'm sure you can all read the comment at the bottom. We are now asking whether young people consider there has been an effect. And a lot of them say that yes, they do feel that this has affected them and is affecting them. So in the first lockdown, there were some positive comments. These have become fewer and far between. I think that we probably as adults may feel that the lockdowns are getting less and less novel, and problems are getting greater, and the young people definitely have echoed that. If you look at some of these quotes, there's a feeling of being trapped, a lot of loneliness, low mood being worse because the things that used to make young people and all of us feel better, many of them they can't do. And then moving on to thinking about sort of the whole problem of anxiety, which is our top presenting issue. Of course, having a live pandemic is going to create anxiety, and there are some quotes about what's made young people feel anxious. And I think that comment at the end, I've heard that a lot recently with this third lockdown and it being extended now beyond the February half term. There's a real fear of this never ending. And of course, for children and young people, there is a different experience than there is for all of us, because they haven't lived, as long as we have. For us, the percentage of our whole life is much, much smaller. And the sense that it will end, many of us have lived through difficulties, perhaps, I certainly don't think I've lived through anything quite like this before, but we've lived through things, and we know that life is nothing if not changing. It always changes. So we kind of know that at some point it is going to change. I think they feel, I'm generalizing here, but there's a real fear that it might never change, that they might be in lockdown forever. And also, if we think about children and young people and their development, I was talking with a lad who is on the autistic spectrum, and he really struggles with social interaction. And when life was more normal, he used to go to some groups. One was actually, he used to play cricket. And he hasn't been able to do any of the activities that he used to do, which used to enable his social interaction. You think about what effect that's having on his development. So he's going further and further into an isolated world. And I think, we're very concerned about our school children and how they will get back into school, how that's going to be for some of the more anxious ones. But we're also concerned about those who have gone past school age, that sort of first branching out into the world. What must it be like for them not being able to do all the things that they would normally be doing at this stage of their lives? So trying to be, ever positive, what have we heard does help? Well, I think everyone has put stuff out over the internet, and thank God for it. We may curse the fact that young people are wedded to their phones and far more adept at surfing the net than most of us. But thank goodness for it. And they have told us that many of the apps, the helplines, the websites, that all of those things have been helpful, as well as things like the 5 ways to well-being, making sure they incorporate exercise, having time with their pets, and a lot of them have been helped by their schools. Schools have tried to keep supporting their pupils even when they're not there. And I think looking into the future, something that would be really, really fantastic, and I don't know whether this board could be proactive in any way to make this happen, is if young people were able to be a part of the build back, if they could feel useful, if they could give to others, if they could, be involved as volunteers or whatever. There's some evidence from countries where they've had tsunamis and natural disasters that where young people are really actively involved in the build back, that has a really, sorry, too many reallys in there, but has a very significant effect on their mental health, as well as, of course, being extremely useful to the build back. So if we could, we're talking with Dave Seward from the Berkshire Youth about how we could have a sort of centre where young people could help each other, and I think something like that would be really fantastic. So my final slide, the positive hope is that in every very, very dark cloud, there are some bits of silver lining, even if there isn't a complete silver lining. And, hopefully some of the young people, many of them, we hope, will come out with a kind of inner resilience that they never even knew they had. And also, they certainly may have sorted out their priorities. And a lot of the sessions I've had with young people, they've talked about really realizing how important family and friends are to them in a whole different way that they hadn't appreciated before. So I hope that's kind of what you wanted. Let me stop screen sharing.
Thanks, Davina.
I wasn't sure.
Can I kick off here, because we've had 2 or 3 discussions over the last week or two about how we actually engage with the young and try and encourage them and get them involved in what we're trying to do in terms of recovery. I don't know whether there's any way you might be able to assist or help in that way.
Well, I would think a starting point, we've got a very tiny little group of young ambassadors. You saw a quote from one of them on that presentation. And I think, certainly could put that to them about how they'd be involved. And we could also, be quite a sort of small scale, but we could, as people finish counselling, we could always ask them if there was a project that was available for them to join. Some of them might like to join. It would be a huge boost to their self-esteem.
I've got Councillor Masters.
Thank you, Chairman. Thank you, Davina. That was really insightful and extremely interesting to listen to. Councillor Wollaston's question and your answer just then kind of answers my question, but I was just wondering about peer support and how much the young people that you work with are involved post your initial assessments, and then as they move on through recovery, how much they support each other. So you kind of touched on that anyway. So I just wondered, is that something that's not formal, or is it something that you do on an individual basis with your ambassadors if they're in a position to help their peers?
It's not a very well developed aspect to our service. It is something that we could, we could get creative about how to make that a more active part of our service. I mean, we have counsellors in schools, for example. So, we could, in conjunction with the schools, work on having sort of mentors almost, I know a lot of schools do have mentors, and you know Nikki Davis, you probably all know Nikki Davis, and she does a lot of work with the mentors. So it would need to be in collaboration with her, but you know, I think there's more that could be done because there's nothing like somebody helping somebody else to help, you know, both people.
Absolutely. That was what I was going to come to, you know, in terms of, you know, sometimes we underestimate the levels of support that, the children and young adults can give each other. So I think that helps build that resilience in, and, you know, and often they'll be more comfortable, you know, talking these things through with each other on an informal basis. So, but yeah, can you thank your team and all your staff and volunteers for all the great work that they're doing already? And thank you.
I will. Thank you.
Councillor Doherty.
Hello, Davina. How are you?
Hi, Lynn.
Davina, thank you for your presentation. It couldn't come at a better time, as you're aware, and I know you're working closely with us. This is Children's Mental Health Awareness Week, so thank you for the presentation this evening. Perfect timing. A couple of questions. I know that you've talked to us about your figures, and you gave us January this year. I'm just wondering about your feelings around pent-up demand. So it's quite interesting that you were saying that during lockdowns you see a drop in the numbers of people you're normally supporting. Have you got a feeling from, I don't know, last January or any indication through the summer of what that demand might look like coming through this? I think we're all very conscious of the impact that the current situation is having on our young people, and there's been quite a lot of reports out there, but I'm really curious here in West Berkshire if we've got an indication of that demand going forward, and then I guess from that point of view how the charity is coping with that. And I'm not quite sure your numbers at the moment as well. What sort of numbers can you take in, Davina?
Well, okay, so I'll do the second part of your question first, if I may. At the moment, we have 30 counsellors, and different sort of counsellors to you lot, and they range from doing only 2 clients to some of them doing 8 clients, 8 young people a week. Obviously, with a bit of money, it's fantastic, because we got a little bit of money from the CCG, where they called it the winter bid, and we got some money and we also got some money from the lottery. We've been able to then pay the counsellors to do more sessions. So currently, you know, we've got about I'm really bad with numbers. This is a real guesstimate, because I haven't got, but I think we have, as you know, almost 300 young people in counselling. I will double check that tomorrow with Tammy, Lynn, and confirm that figure with you. The first part of your question was about what about the surge, you know, as we could. Well, we think we had a surge in kind of September time. You know, the September, October, November, December, there were pretty high numbers of referrals coming through our door. And we expect that there might well be another surge of a similar size, you know, whenever this lockdown does come to an end, so early March. It's going to partially depend, I think, on what they do about exams and the years 11 and 13, because often we get a very large number coming to us as they go towards mocks and the exams. Well, if they've been really well managed with that, and they're not feeling too anxious about that, that might make it slightly less dramatic a surge for us, if that makes sense.
Yeah, no, that's really useful. Thank you, Davina.
Councillor Berg.
Thank you, Chairman, and thank you, Davina. I'd like to add my thanks to the thanks you've already received. I'm lead member for children and young people, and as Lynn said, it's really timely that you've come to us this evening to talk about your work, and I'm really pleased to hear some of the things that you were telling us about. We are at the moment, Chairman referred to it, we at the moment are having a look at how we can better engage with our young people in these really difficult times, and you've given us some good ideas. Just a question around, my questions have been largely answered by what you said to other people. Are you finding that you're facing new issues that young people are bringing forward, or are they the usual issues just amplified by intensity?
What a brilliant, interesting question. They're mostly old issues, like, depressed people being more depressed, anxious people being more anxious, alienated, isolated people feeling more alienated and isolated. However, I suspect we may see some new things, but I think they won't come through just yet, because what we may see is effects on development. And that may be actually younger children, but it's particularly what they've missed in terms of being able to socialize. And I gave you that little example of the autistic boy, but you think about, all the non-neurotypical young people who will have missed massive chunks of helpful development. So we might start to see some new stuff, but we're not seeing anything new yet.
Thank you.
Councillor Bridgman.
Thank you, Chairman, and thank you, Davina. One of the hats I wear is as a chairman of the Community Hub Core Group, and we had a meeting earlier this afternoon. And one of the things that we look at is what's coming out of the voluntary sector and out of the charities. And the piece that we got from Time to Talk was about your session that you'd run with parents fairly recently. This was a thing from Tammy sent this through. So I just want to pick that up with you, because that sounded quite interesting, and another angle to the children and young people piece. What I'm keen on, and we had a conversation about this, and looking at Martin, Zoe, I hope took this away, but maybe you can make sure this is followed up, Martin, to talk to you guys about how, if you want us to, we spread that particular message about having sessions, because my children are far older than is necessary for this particular conversation. But if I did have younger children, I'm sure I would like to talk to someone who knows what they're going through as much as trying to talk to them. So I'd just see what you think about that.
Yes, we're doing a series of 4 kind of seminars for parents around the difficulties that young people present to us, and also the adolescent brain and how it develops and things like that, and also about parents looking after themselves, because obviously the more capacity a parent has, the better they're going to be able to do the parenting, and the less problems the young people are going to have. So we see it as a kind of managing our wait list in a very indirect but very significant and important way. And also, for all of us, parenting, well, I speak perhaps for myself, but I imagine a lot of us share this. Parenting is probably the most difficult thing any of us ever do. So the more we can support people through that journey, the better. I wasn't quite sure what you meant by, did you say something about collaborating or?
Well, really, it depends on who you are seeking to engage with to get parents along. I mean, obviously the market, if I can put it like this, is pretty vast. And I don't know what your numbers look like. If you're trying to run, I don't know, we didn't go into the depths of what a session looks like, how interactive it might be. And so if you've already got a full waiting list, if I can put it like that, then that's one thing. But if you were looking to engage with the kind of people we are talking to through the community hub, then I think we'd be very interested in spreading that message.
I think there's loads that could be done. And I think we could also involve, the Emotional Health Academy and, children's services, I think there's loads that could be done. I think we've only scratched I think this is so important, because well-supported parents improves the mental welfare of our young people. So I just think there's nothing more important than this, really. Our current seminars are, I think we had 80 people. I had to scroll through about 3 pages of Zoom to see all the faces. So it was well attended, not particularly interactive, because with so many people, it's nearly impossible to be so. But there's nothing to say in the future we couldn't design more interactive, longer courses, blah, blah, blah. There's loads that could be done. I don't know who if you tell me who to stay in communication with, we could look at exploring all that.
Well, I think what I'd suggest through the chair is that we pick that up outside the session. We've got your contact, and there are enough people on the call who know what we want to achieve that we can pick this up outside the group.
I don't see any more hands up. Davina, thank you very much. I thought that was a very productive 20 minutes, actually, and hopefully something will come out of it going forward. Thank you so much. If we could move on perhaps to Ginny Garnett, who's Head of Community Children's Services, Berkshire Healthcare NHS Foundation Trust, to talk about health visiting.
Good evening, everyone. So I just thought I'd start with just setting the scene for what a routine health visiting service is. So it's universal. Any child under 5 is on the caseload, and we start to become involved with parents actually in the antenatal period. From 28 weeks, we get referrals from our midwifery colleagues, and our pre-COVID offer was to provide an antenatal session in the evenings for parents, unless the families were identified as what we would call targeted, so there were additional needs. And then we have 4 further contacts with families. One, the new birth, which is by day 14, and the 6 to 8 week check, and then 9 months and 2.5 years. That's what everyone is offered. And then, depending on the individual needs of families, it's probably between 2 and 3% of families who have either what we would call a universal plus or universal partnership plus. Partnership plus hopefully explains what it is, in that there are other agencies involved with the family. Back in March, or either March or early April, we had guidance from NHS England around how services should be delivered, what should be suspended and what should be retained. And there was, so this was a national decision, and that decision was to only retain the new birth contact and the 6 to 8 week check. And then some of our staff, not the qualified health visitors, some of our staff were redeployed to other areas. There was a national advice about not going into parents' homes, and in fact we found that quite a few parents didn't want visitors in their homes. And we set up very quickly a digital platform using one consultation. We tried very hard, if we knew we had a targeted family, that we would do a face-to-face contact in the home. But we are guests in the home, and there are some parents who either rejected our request to visit them at home. Maybe they were quarantining, self-isolating, or they had another vulnerable member of the staff in. So we've had to make lots and lots of changes. The video platform we used was obviously secure, but what we found with some families is they either didn't switch the camera on, they couldn't switch the camera on, their bandwidth wasn't sufficient, particularly in, say, more rural areas where the broadband speed is quite slow, or that it was going to take up too much of their data if they were, they're depending on their contract with their service provider. So we quickly went through a process where we started to identify needs, and we kind of rag rated our families into red, amber and green, and so that everyone knew, no matter who went into the records, that as to what the level of need was. And we also worked very closely with our midwifery colleagues, so we tried to dovetail the contact that we had, so that we weren't both contacting a family on the same day, because they had also added in some additional, largely telephone contacts. One of the things when we see a new family, when we talk to the mother, we have certain screening questions that we ask, and one of those is around domestic abuse. That's a really hard question to ask in a face-to-face environment, let alone as on a digital platform. So just more recently, the practitioners have come up with the idea, they call it the over-the-shoulder. I'm sorry, I've got a dog annoying me here. They call it an over-the-shoulder poster, so that as the practitioner is sitting there in front of her screen, behind her is a screen about domestic abuse, to just try and raise awareness, and that if they want to talk to anyone, that they know how to contact. We know that nationally there's been around about a 25% increase around domestic abuse, and of course in the initial lockdown we didn't know what to expect, so nationally there weren't really measures in place to protect those families, particularly mainly mums. We routinely also run a duty health visitor advice line, which is open to parents and professionals. And what we did was we extended the operating hours. They're normally 9 until 4:30, and we extended those to 8:30. I think initially we had a fair amount of calls, but actually as the lockdown progressed, we were getting less and less calls in those extended hours. Again, routinely, we normally have baby clinics across the locality, and our baby clinics are either in the children's centres, village halls, children's centres and village halls, where they were all closed. And also we couldn't run them in a normal way. We had to run them on an appointment basis, so that we could maintain all the social distancing and so on. And what we were able to do was, when the children's centres weren't and the other centres weren't available to us, we found some alternative venues, some of those BHFT sites. And the team also offered what they called scale drops. So our staff would leave the scales on the doorstep by arrangement with the families. And if they wanted their child, their baby to be weighed, they could self-weigh, because when we are routinely running our baby clinics, we run it on a self-weigh basis. I think the important thing to point out is that baby clinics are not just about weighing babies. You know, it's about a socialization, it's about parents being able to network, and they will ask about general things around feeding, sleeping, nappy rash, all of those sorts of things. So I just wouldn't want anyone to go away with just thinking that all we didn't do was weigh babies, because I think it's a lot more than that. We also increased hugely our social media presence, and we have a professional lead for health visiting, and together with the teams we did lots of blogs and vlogs, and posted them out through Twitter, our website and social media. And we've recently done some mapping of that, and I can't narrow it down to West Berkshire, but about the reach that we had, which was very, very positive. Recognising the isolation of parents, the team introduced what they called welly walks at safe distancing. So that was in collaboration with our colleagues in the children in the children's centres, and that gave parents the opportunity to walk in the fresh air, and being able to sort of seek advice from our professionals and our children's centre colleagues. The team have also, because we could no longer hold the antenatal presentations, we've developed that to be a virtual antenatal presentation. We've now extended that presentation to all mothers across Berkshire West. So that it offers some flexibility, because actually the parents can watch it at their own leisure. They don't have to come at 7 o'clock on the third Wednesday of the month. But what it also doesn't do is allow those parents to be able to network with other parents who are due their baby at the same time. I spoke earlier about how we dovetailed our service model to fit with midwifery. So as I've already explained, at our normal first contact with parents would be between 10 and 14 days. So what we did was we introduced a 4 to 5 day telephone contact. And that was to offer feeding advice, but also anything else that the parents may have concerns about. We then offered another contact at 4 weeks, and then at 12 to 14 weeks. And again, these were telephone or virtual contacts, but that was really because nationally and locally, we have seen an increase in non-accidental injuries, particularly for babies under 1, and a high risk area is the baby, under 6 weeks. And as I've already said, an increase in domestic abuse incidents and poor maternal health. The health visiting service was reinstated, albeit on a limited way, because of the limitations around providing the clinic-based service, which is the model that has been commissioned largely within West Berkshire. That was reinstated around about the end of June. So we have worked very closely with our local colleagues in terms of trying to get the service back up and running. What we are focusing on is having eyes on the young children, the much more vulnerable one. We know that most non-accidental injuries, there is a higher incidence in crying babies, in those first few years of life. And parents have additional pressures. They've maybe got financial difficulties, housing difficulties, the stress of not being able to see their extended family. So that's why we introduced those contacts. The new birth visits were reintroduced face-to-face from the 1st of June. Our staff wear PPE, and that is in the home. And we've also reintroduced the 6 to 8 week check. For universal families, we may well see them in a clinic setting if we can get the venues, but we have been challenged, as everywhere is, with the children's centres and how they're reopening, and our access to those. So whereas, if we could see 10 children in a morning, we may only be able to see 4 children because of the appointment spacing and so on. We are seeking parental feedback after each of our contacts. I don't think we've seen a significant increase in access to the duty line, but that has remained steady. We also worked with our GP colleagues to try and get them to time their check that they do with the baby to be at 8 weeks, so that we're not seeing the baby at the same time as them, so that we're spreading the contacts out. We are doing less of our other routine contacts because it is taking longer if we're providing a more home-based service because of the limitations of venues. So I don't know if anyone's got any questions.
Thank you, Jenny. That was very insightful. I've got Steve Masters first of all, and then Councillor Doherty after that.
Okay.
Councillor Masters.
Thank you, Chairman. Thank you, Ginny, for that briefing. I had a question for the board ahead of knowing that you were coming on board, but I don't know whether you'd be able to answer. Somebody's been asking me, with working families and during the epidemic, and with young children under 5, for example, what happens if both parents were to fall ill and and were incapacitated to the point where they were unable? Would you be getting involved and passing it on to social services? What would the arrangements be?
Well, anyone really who's aware of that may impact on the welfare of the family of the child would have a responsibility to contact social care. Social care would then make an assessment, because sometimes they might be able to arrange kinship care. Yeah. But I guess if a family was seriously ill, they may have to be temporarily accommodated. But that's generally a decision that rests with children's social care as the main agency. Yeah.
Okay. Thank you very much.
Yes, Doherty.
Hi, Ginny.
Hi, how are you?
I'm very well, you?
Good.
Ginny, obviously at the new birth visit and the 6 to 8 week visit is the time where normally we detect if the mum's got postnatal depression. It's part and parcel of the questionnaires. It's been picked up today in an earlier meeting I was in from Home Start that there's a concern that we may be missing and not getting those, and it's really interesting to listen to you talk about the digital difficulties and what that does as a platform to enable that sort of contact that you might need. I was fascinated to listen to the domestic abuse piece and sat there thinking in my mind, well, the same applies with the postnatal depression piece. Yeah. Now, have you seen, because obviously you have numbers of detection rates, have you seen an increase in postnatal depression over this period of time, or have you seen a decrease which may indicate that we're missing some? Have you got a view on whether we're getting
I think
slipping through?
Yeah, I think we're not picking them up. I don't think it's not there. I think it's not picking them up. Health visiting is about relationship building, and it's about trust. And, to disclose that you are maybe the victim of domestic abuse, that is a really sensitive thing to disclose. And actually, over a digital platform, would you tell me, for somebody you've never met before, it's about continuity of care and building that trusting relationship and feeling in a safe way. So also, when a health visitor goes into a home, they are obviously sensitive to the fact that you cannot ask if the partner is there, do you feel you might be at risk of domestic abuse, however the question is worded. And so health visitors make that judgment around how they will ask it and when they will ask it, and they pick up on non-verbal cues. You can't pick up on non-verbal cues on a digital platform. And also, what about when the parent doesn't have their camera on? And even if you guys have no idea whether somebody is sitting in this room scowling at me or not, and that's the same for a vulnerable mother. And so it was a temporary measure, but how we rebuild that, because what we are getting, not necessarily from West Berkshire parents, is one of the themes that we've started to see in complaints or concerns that have been raised is, how do I know what's normal for my baby? How have I got this information? I'm a first-time mum. I haven't come to baby clinic on a monthly basis. Nobody said, "Oh, don't worry, Mrs. Smith." And they haven't got the support of their network of friends and family on hand. And the increase in the stress for families. And so there's a whole bunch of things. And I think it was the last quarter. I've only just have this quarter's data, so I haven't looked at it properly. But the last quarter data, one of the team really had a look into it and compared it with last year, and there was a significant decrease. So we wouldn't necessarily automatically refer someone to the perinatal mental health team. It depends the score and the type of story they're telling you, and other risk factors. But we might offer some continued contact with the mother, and then make a decision. It's very much, you know, it's led by the client and the judgment of that experienced clinician. So you know, we have had some very sad cases. We have had a maternal suicide. I think not really as a result of the pandemic. I think that particular lady had long-standing mental health problems. But if I look back and I think of the type of support she would have got pre-pandemic, I can't surmise whether the outcome would be different. It may not be. And we've also had either serious injuries and so on. So, and I don't believe that West Berkshire is any different significantly. I think the other thing I haven't said is Ruth May, who is the chief nurse, submitted a statement in October, I think it was, that with any further lockdowns, no health visiting staff or public health nursing staff would be redeployed. And so far that has been maintained, and we have no intention of doing it. We do have some staff who are shielding, and then we sometimes have staff who have to self-isolate. Worth also saying that we are having some challenges with some of our staff getting school places for their children so that they can do their job. So that's been a little bit of an issue this term. But yes, but yes, in answer to your question, Lynn, I think it'll be interesting what's storing.
Yeah, well, that's your presentation and Davina's before. It's about that building of demand is what I'm hearing, and what happens as we come out of lockdown, and what we need to make sure is in place going to make sure that support's available and everything. So that seems to be the reoccurring message that we're hearing this evening. So really useful. Thank you, Ginny.
Can I say some other things? I think the other thing that we're not doing, because we're not doing the developmental checks as many and the 2.5 year checks, I think the other place you're going to see the surge is that children with unidentified social and communication issues, and how that manifests itself later down the line, because we have had to prioritise. We can't do it all when we can't operate in our normal way. So you know, particularly the 2.5 year check, you know, if you know, we're talking about school readiness and their social and emotional development. And I think we will see, and what we're finding when we've reintroduced them is parents aren't necessarily taking them up, because they're almost thinking, well, what's the point? I haven't had a health visitor for, you know, since March last year. Why do I need one? And that's the problem when a health visiting service is less visible. So I think that's a big problem that I think, as well as the stresses for parents, and you know, children who don't get normal socialization, but also about what we're not identifying in terms of needs.
Okay, thank you.
Jenny, thank you so much. Clearly we have some more challenges ahead of us once we get past this nightmare. But thank you for what you brought to us tonight. Much appreciated.
Okay, thank you.
Can we move on to Matt Pearce to bring us up to date on the situation report and incidents?
Thank you, Chair. I have reduced the slides in the interest of time, so I'll just go over the key points that we need to cover this evening. So as always, the overview of where we are in West Berkshire at the moment. Obviously, this doesn't take into account the data that's just been published this evening by the government. So to date, there's 5,420 cases of COVID-19 in West Berkshire since the start of the pandemic. 355 of these have been in the last week. And the date of writing of this particular presentation, the cases per 100,000 was 224. I understand it's now at 200 per 100,000. And the positivity rate has dropped to 9.6. So we continue to see a steady decline in rates across West Berkshire and our neighbouring authorities. So that's really positive. And our rate continues to be below both the South East and English average. In terms of the trend in the data, so again, this slide just represents each of the 6 local authorities in Berkshire, the blue bar representing the local authority, the orange bar representing national, and the grey bar representing the regional. And as you can see, all of them on a decline. With West Berkshire, a question was asked earlier today, actually, in terms of the rate of the decline in West Berkshire. So it does appear that our decline isn't happening as quickly as the other authorities, but we're probably starting from a lower level. When I looked at the last 7 days and the rate of the decrease, our decrease was around 17% compared to the previous 7 days. And that compared to the regional decrease of around 33% and the national decrease of 28%. So we're not falling as sharply, but as I said, it could be down to us not necessarily having as high a number of cases in West Berkshire. And the fact remains how low the rates will actually go. Obviously, we know this new variant is more transmissible, and data in West Berkshire is about 78% of all our cases are attributed to the Kent variant, which is the more transmissible variant in the country at this moment in time, and not to get confused with the South African variant, which has been in the news today. And there are a limited number of cases and more investigations underway around that. But as we know, in general, the new variants aren't necessarily as severe, just possibly more transmissible. In terms of the deaths, sadly, there has been 183 COVID-related deaths during the pandemic, and 6 deaths were recorded in the latest week of data that we had was between the 9th and 15th of Jan. And throughout the pandemic, our all-cause mortality rate has kind of stayed around 20% higher than we'd normally see over a 5-year period, which equates to 203 additional deaths in its entirety. The hospital activity, we do actually now publicly able to release the hospital activity for the Royal Berkshire Hospital. So again, but it's slightly dated. The overall position really is that admissions are slightly increasing or plateauing. It varies, but the position is improving, but clearly the NHS is still under immense pressure. And it's important that the public continue to play their part. I just wanted to quickly cover about the community testing, community testing, which I thought was just worth noting. And it's just really to keep the board aware and the public that we're working quite hard to get community testing set up in West Berkshire, hopefully by next week. And the reason this is really important is that 1 in 3 people, as we know, who have coronavirus have no symptoms. They are asymptomatic and they may be spreading the virus without realising it. So we've been working hard with the government, Department of Health and Social Care, to set up local testing sites in West Berkshire. This will complement national testing programmes, so people will be familiar with care homes testing, primary and secondary school testing, maintain nursery school workers and workplaces with 250 employees. And I understand that in the future, employees or companies with 50 or more employees will get access to testing soon. So this very much complements that national offer, and we'll be offering community testing twice a week to eligible key workers. These are critical workers that can't work from home, that are critical to the functioning of the country. And as I said, our first testing site will go live in Newbury next week. More details to follow later in the week, and we're hoping to complement that with further testing sites throughout West Berkshire over the coming weeks. I do see a hand up, so I'm happy to take a question if it's a good time now.
Well, Matt, you've managed to come up with something I hadn't heard today in the other 2 presentations you've given to some of us, which is about the rate of asymptomatic individuals. A question whether you're aware of any research or any data on whether those individuals are more prevalent in particular age groups. I'm just wondering whether there are more people who are asymptomatic in a particular level of the cohort and how that might affect the testing regime.
It's a really good question, Graham. I might defer to Meriden. My sense is possibly younger people might be more likely to be asymptomatic, but I don't know if Meriden has an answer. Otherwise, I'll have to take that one away. Meriden, do you have a view?
Meriden, you unmuted yourself and then muted yourself again.
How's that? Here we are. We don't actually know fully the answer to that. There's been a lot of testing of whole populations and through primary care, through sentinel testing. And also there was some testing in London of all care homes. So it was back in April, May last year that they realised that there was a significant amount of asymptomatic. And what they found then that there were around about 30% of asymptomatic people in care homes, as opposed to those who were symptomatic. So unfortunately, we don't fully know the answer to that one.
Can I come back on that though? If they were showing 30% in care homes, and now are we talking elderly care homes, learning disability care homes, or a mixture? Because after all, if the rate in the general population is a third, and you're getting 30% in, for example, elderly care homes, that would indicate there isn't a difference between the elderly and the young in terms of who is or is not asymptomatic, which is intriguing because I would have assumed, like Matt suggested, that you'd have more asymptomatic amongst the young, but who knows?
Yes, I mean, that all makes sense. I mean, this study in London was done, I think it was around last April, May. So it was quite a long time ago. But there hasn't been systematic testing of the population for us to fully know that, of all age groups. They've done some age groups, but not everybody. So unfortunately, we don't fully know the answer. You're right, it probably does suggest that it's probably across the board. And we're finding asymptomatic staff in care homes, residents, as well as young people.
There is some surveillance testing going on through the ONS, so I wonder if we can maybe explore what data they're looking at and whether they're identifying specific age cohorts. So I'll take that one away. Happy to feedback. So I think I've probably covered that, and I guess I probably just wanted to say this actually forms a repertoire of kind of approaches, and I think it is a whole system approach when we're looking at COVID-19. So I think there's a lot of emphasis on vaccinations at the moment, and quite rightly so. That is one of the ways we will exit this pandemic, but clearly community testing is another one, and contact tracing is another one which we know is really effective, sit alongside that, both community testing and vaccination. So I just want to share a bit of data very briefly, conscious of time. So our national test and trace data showing that 90% of people who test positive have been contacted by NHS Test and Trace, and of the contacts that have been identified, 86% of those have been contacted by NHS Test and Trace. As we know, SAGE recommend anything higher than 80% is good, so we're faring well there. In terms of our local test and trace partnerships, so that's rolled out through the Public Protection Partnership team at the council. We're averaging around 10 new daily case referrals from NHS Test and Trace at the moment. So that is picking up people that the NHS Test and Trace service are unable to get hold of. And out of that, about 60% of those referrals are successfully being contacted. So I think that's really good. So 60% of those who were not able to get contacted by NHS Test and Trace are being followed up and contacted. They're being provided close contacts, exposure information that feeds into our overall local intelligence. And just to make the point that we have seen a 36% increase in volume compared to October and November. And obviously with the priority groups, obviously just to make that point, I said it's really important. The aim is to continue to hit the target of all 4 of the top groups by the 15th of February. And that's very much in line with the government target. And I understand that Berkshire, West and West Berkshire is on target to achieve that. Finally, again, the other part of that is all just having our role to play, hands, face, space, following government guidance, testing and self-isolating. The virus will still be around for some time yet, and it's really important we all continue to follow those guidelines. And then finally, as always, just a plug for the website. The latest information can be found there, and we've got lots of new information on there around testing. Our new social media campaign continues to focus on how we can encourage young people to comply, and lots of other videos as well. And we're also just about to put lots of vaccination data on the website as well. That concludes my presentation.
Thank you, Matt. Just to confirm, I was self-isolating last week because I got caught on track and trace. It's clearly working. I don't see any questions. I saw it. Alan Macro.
Thank you. You mentioned the ONS surveillance testing. There's been a fair amount of publicity recently that the kind of number of cases they're detecting is not going down anywhere near as dramatically as the kind of case data from the kind of test and trace. Do we have any idea why that might be?
Yeah, I've heard that as well, Councillor Macro. And again, I'll defer to Meredith. I don't know if you have any thoughts in terms of why that might be. So you're saying that the test and trace data coming through in the cases doesn't necessarily align with the ONS infection survey, is that right?
That's right, yes.
Yeah, I don't have an answer to that. I don't know if Meredith, you do.
No, I mean it's a really good question. I think the new variants have changed things because the new variant is so much more transmissible. So it's very hard to compare what's happening at the moment with what happened around 9 months ago. So it's a good question, but there are a lot of, we can't answer all the questions at the moment. PHE are doing the REACT study, they're doing surveillance, there's the ONS, there's a whole range of them, but we haven't necessarily got all the answers at the moment.
Thank you. I just wondered whether it might be getting younger age groups infected, and now going back to what somebody was saying earlier, whether they're less likely to be symptomatic or something. Yeah.
But there's no real suggestion that any particular age group is less likely to get this virus than another. So it's not hitting one age group over another. What it does is it has more severe symptoms in some people, and it has less severe symptoms in young people. So young people are still getting symptoms, but it's just very mild. They're not really sick from it. So I think it's affecting people differently. And then this new variant is very difficult to compare because it just transmits so much more quickly. But there's no suggestion that it is actually hitting any particular age group in the population more than another one. It's across the board.
Okay, thank you.
Conscious of times, can we move on to communications and Martin Dunscombe?
Thank you. Good evening, everyone. By way of an update on the key communications activities that we have been working on over the past couple of weeks, in which we continue to work on, community testing is a big area of focus for us at the moment. You just heard Matt talk about the community testing sites, which we are in the process of setting up. So we're busy supporting that, not only in terms of sort of making sure the communications for those being tested are done properly, but also just raising awareness amongst the general population about the testing facilities that we're doing, and providing that reassurance to local residents that it's part of the ongoing response to COVID. We've already got a dedicated web page up and running. We're beginning to drip feed out the communications now, both in terms of our sort of stakeholder week notes and in the newsletter, which goes out to residents every Friday. As soon as we've got the details confirmed a little bit closer to launch, we'll be doing much more visible communications on that. And we've also been working on the online booking form as well to make sure the customer experience is as seamless as possible when people come to go and book their tests. We're working with our colleagues in the Public Protection Partnership at the moment ahead of the introduction of COVID support officers, which is another element of the COVID response. So we'll be doing some comms on that over the next few days. Really, it's all about raising awareness of the fact that this new resource is going to be here, and providing reassurance about what they do and don't do, just so that when they do start, there's those expectations have been met in terms of what their role is. Vaccine and vaccination program, obviously another key area which residents are asking us about at the moment. Now, this is being delivered by the NHS, and we're very much taking their lead in terms of the communications that we have around that. Since the last meeting, we've published a new page on our website with some basic information about the vaccination programme and signing people through to the NHS, where there's more information available. We've been sharing updates about the vaccination programme on social media. The leader did an interview with Dr. Irfan last week from the CCG with Thames Valley TV, which was all about vaccinations, and again just raising awareness of the vaccination centre that we have here in Newbury. And also on the subject of vaccinations, we're working with Community United to deliver a new webinar on vaccinations, which is going to be Thursday evening, 6:30 to 8 p.m. And that's all around providing information about the vaccination programme. Matt will be taking part, as will other local doctors, and giving local residents an opportunity to ask questions that they have about vaccinations. We know there's some misinformation circulating online, so it's an opportunity for us to sort of separate sort of the fact from the fiction and provide residents with the information they need to know about vaccinations. We were on BBC Panorama last week as part of our sort of ongoing work to, sort of raise awareness of the human impact of coronavirus on local residents, particularly those that have been bereaved. So Sarah Ross from our adult social care team was on that programme, talking about her experience working on the front line of COVID in one of our care homes, or across our care homes, and that was a powerful piece. I don't know if you've watched it, but really sort of showed the impact of that. Just to whiz us through a couple of other things, we did some comms last week around the infection control measures that we have in our care homes, Willow's Edge care home in particular. This was really around providing reassurance that the CQC have come in and scrutinised our infection control measures and found that they are being done properly, and also they were positive about the work of the management and the care staff there as well. So that was an important thing, I think, for providing reassurance. We're planning some more communications around community transmission, particularly in supermarkets, shops, and other communal areas, such that we continue to promote social distancing and the restrictions as well. Our newsletter continues to go out to residents every Friday. We've issued 47 bulletins since we began that back in April. They've been opened by residents more than 2 million times. That continues to be a really important channel for us in terms of getting that information out into the hands of residents. Conscious of time, just two more things. We've heard earlier that it's Children's Mental Health Week this week, so we're working with our Emotional Health Academy, our educational psychologists, and other colleagues around the council to share resources with head teachers and with parents on that. There's something in the Newbury Weekly News website today about that. We're sharing resources for teachers as well, because it's important that we look after the people that are looking after our young people too. So we'll continue to promote that this week. And finally, since the last meeting, we've been able to announce this year's Community Champion Awards, which was a positive from our perspective. We had some special categories this year for those that have been involved in the COVID response, and it was nice to be able to recognise some of the community contributions that we've seen over the past year or so. So happy to take any questions, but that's a summary of where we are at the moment.
Thanks, Martin. Looks like you've escaped. No questions. Could I ask members to come up with any suggestions to James for the next session in 2 weeks' time? I do think these sort of visiting presenters are quite helpful. So are there any ideas would be gratefully received? Any other business? I can't see any. So I think that concludes the business of the evening, and thank you for attending, particularly members of the public who may be streaming or watching later. I wish you all a very pleasant evening.